On April 26th, a group of armed former Seleka rebels entered the MSF hospital in Bogila in northern Central African Republic and carried out a brutal attack that left 16 people dead.
The team had organized a meeting with local community elders in order to discuss some medical activities, but also to discuss the security conditions in the region, which had deteriorated. Whilst that was taking place, an armed group entered into our compound and with the purpose of robbing MSF. Taking our money and taking our resources. Whilst that robbery was in place, something went horribly wrong, and hence as a result the robbers they killed and murdered 16 people, primarily community elders, but also 3 of our own national staff.
MSF pays tribute to its 3 staff members. Deeply affected by the attack, the team at Bogila Hospital suspended its activities immediately. In protest and to underline the need for humanitarian work, the 2,300 people employed by MSF in Central African Republic are reducing their activities to emergency medical care only for a week. The events in Bogila reflect the insecurity rife throughout the country. In Bongi, 1,300 Muslims who had taken refuge in the north of the capital left in a convoy under African Union escort on April 27th.
The Christians come and throw grenades. It's not safe for us here. That's why we want to leave.
They're headed north of the country where they hope to be able to live in peace. But the very next day, anti-Balaka fighters tossed a grenade into one of the trucks, killing 2 people. These scenes, filmed last month in South Sudanese refugee camps, already showed how critical the situation was. It's May now, and conditions have worsened as the rainy season sets in. Camps are already getting flooded.
Water supply is still at the acute phase, is still below the acceptable standards. And the issue of shelter, now with the rains coming and possibly malaria season will start soon, so the shelter issues are still a major problem.
We estimate that the number of refugees may well reach 150,000 within a few weeks. But in spite of the dire conditions here, they have no intention of going back home.
The refugees we find in Gambela, most of them are fleeing the conflict in South Sudan. A majority of the arrivals are mainly women and children. I think it accounts for about 90% of the number. These people, due to the long distances they have to walk, they arrive basically in a fatigue state and very tired.
Malnutrition, measles, malaria, cholera. If refugees are not already ill with these diseases when they get here, they are susceptible to them all, particularly younger children. MSF works in 3 camps providing medical consultations and inpatient care and vaccinating children as they arrive. But the teams see that the priority has to be improving living conditions to prevent the refugees' state of health deteriorating still further. We're on the banks of Lake Victoria in the sub-district of Ndiwa in western Kenya. HIV/AIDS is rampant here. MSF already operates in Homa Bay, some 30 minutes drive from Ndiwa, and now works here too in cooperation with the Ministry of Health.
I could not go to Homa Bay because from my place to Homa Bay was 200 shillings. That is 400 to and fro, and that is why I decided to come to Ndiwa, because it is much closer than Homa Bay.
MSF's programme aims to reduce transmission of the virus and the mortality rate of people living with HIV/AIDS. The organisation provides technical and financial support and trains Ministry of Health personnel.
Ce qui fait l'originalité de ce projet, c'est qu'on dispose What's special about this project is that, before launching it, we had access to rates of new cases of HIV infection in the population, so we can set the target transmission rate we want to achieve. This means trying to combat the epidemic itself, keeping it in check, and then, in a few years' time, we'll be able to use the same survey for measuring transmission and assess how well our program worked, a real first.
This theatre group sings and dances to raise awareness amongst communities and encourage testing, because many people here aren't aware that they are HIV positive. Our testing campaign will target pregnant women in particular, as treating HIV positive women reduces the risk of transmitting the virus to their newborn babies. Madawa district in southern Niger. This video footage, filmed back in September 2013, shows the country's first malaria chemoprevention program.
It's an anti-malarial treatment given to all children between the ages of 3 months to 5 years to protect them from the disease during the seasonal peak.
Recommended by the World Health Organization, treatment is easy, 4 tablets a month for 4 months. During the campaign in 2013, over 200,000 Nigerian children benefited from the program, 3 of them Mariana's.
My children often get malaria. They get burning hot fevers, they have convulsions, and they vomit. They get diarrhea too. Thank God there are less cases this year.
The chemoprevention strategy has been a success in Niger. It has proved easy to implement and effective in reducing the number of malaria cases. Combined with other ways of combating the disease, such as providing access to screening, treatment and insecticide-treated bed nets, it can have a real impact on the number of cases and mortality rates. Haiti after the earthquake, Libya during the revolution, and at the moment in the Central African Republic where a violent conflict is raging. In settings such as these, where medical teams provide emergency treatment, the physiotherapist plays a vital role. Present in operating theatres, on wards and in outpatient departments, sometimes working in cooperation with other NGOs, the physiotherapist delivers the care patients need to help them regain the best quality of life possible.
Physiotherapy starts immediately after an operation, to avoid patients developing disabling conditions that can occur very quickly if nothing is done. So we try to prevent stiffening of the knees and ankles and muscle wasting to get patients back on their feet as soon as possible and shorten the time they have to spend in hospital.
At the General Hospital in Bongi, many patients have bullet or knife wounds. Day in, day out, physiotherapy sessions help them to recover. Tahir has 15 machete wounds. He's already spent several weeks in hospital, but his condition continues to give cause for concern. Today is the first time he manages a few steps beyond his room. In Central African Republic, as is often the case in emergency settings, the physiotherapists don't need sophisticated equipment. Just some simple movements can help stave off complications.
In emergency settings, once patients are discharged, we often have difficulty in getting them to do physiotherapy, as they don't always live in the region and have a long way to come. In these cases, the physiotherapist must focus on accompanying the patient and the people around him to make sure that when he's discharged, he understands why he has to keep up with the exercises.
Because treating patients also means making sure that when they leave hospital, they'll be able to go back to their lives and jobs and look after their families. In countries where infrastructure has been wiped out, part of the doctor's work is helping wounded people regain their independence.